is a very important part of the study that I'm doing with some colleagues down at TGen, Translational Genomics Institute down in Phoenix, Arizona. And Bodur Salih, my collaborator on that, and I have been working on taking primary metastasis cell lines out of bone and brain and starting to analyze them, not just for genetic changes, but epigenetic changes, changes that occur in the RNA, changes that occur in DNA methylation that allow different gene expression. One of the targets that we have found that is altered in a number of these brain metastases is on MAP kinase or MEK pathways. These pathways are very commonly dysregulated in a wide variety of cancers, including gliomas, primary cancers, and metastases. And what we're showing is that this may be a way in which we can select specifically targeted therapies that we can work on. The biggest problem that we're finding, though, in whether it's a brain metastasis, a primary tumor, or a primary brain tumor, is that there are multiple different pathways through which cells receive signaling from the outside environment, and then the cancer cells rev themselves up so that they can survive the insults that we as clinicians throw at them, whether it be surgery, radiation, or drug therapy. So the MEK kinase pathway is but one pathway that we may be able to alter in these brain metastases. The biggest problem that we will likely see as we move toward clinical trial in brain metastases is similar to that we've seen in a number of other primary and secondary tumors, is that when we squeeze down on one of these cell signaling pathways, like the MEK kinase pathway, often the cell has multiple different avenues that it can shunt signaling past that constriction point that we put at it with a drug so that it can survive. So we think the MEK kinase pathway may be a target that we can use, but it's going to likely have to be in combination with other therapies in order to get a good clinical response.